Meet Linus. He recently left the hospital after a central line was placed into his veins. The hospital gave him a few instructions of what to do, and his home infusion nurse visited just yesterday to teach him how to administer medication. Linus is really tired, and while his spouse could help take care of him, he's concerned that her rheumatoid arthritis is going to make the process of twisting an alcohol pad around the catheter really difficult. The home infusion nurse gave him a number to call if he needs help, but Linus still isn't really sure if he flushed that catheter correctly last time. This situation is an example of the experience that home infusion patients with a central venous catheter face. While central venous catheters are an important delivery method for high-flow medications, they are also a potential avenue for bacteria to enter the bloodstream. Specifically, bacteria growing on the external or the internal surface of the catheter can enter the bloodstream, resulting in a deadly bloodstream infection. In order to stop these infections, a bundle of infection prevention tasks is performed during the insertion and daily use of the catheter. Beginning with the work of Peter Pronovost, significant time and energy has been put into implementing this infection prevention bundle in the hospital setting, and there has been a significant decrease nationally in bloodstream infections. Much less attention, however, has been paid to central venous catheter infection prevention in the home setting. Patients requiring long-term antibiotic and nutrition therapy are commonly discharged from the hospital while their catheter is in place. And this type of therapy is actually projected to significantly increase. Hospitals continue to face increasing cost pressure to discharge patients quickly, and more patients want to receive their long-term care in the comfort of their home. While at home, patients and caregivers are trained by a home care nurse how to perform catheter maintenance tasks. Specifically, patients and caregivers are responsible for ensuring proper hand hygiene, disinfecting the needle's connector by scrubbing the hub, flushing the catheter with saline or heparin, connecting the catheter to an intravenous medication source, and protecting the central venous catheter during showering. After receiving training, patients and caregivers are responsible for catheter care with only regular weekly visits from a home infusion nurse to check in. Mistakes and errors with central line infection prevention practices by patients and caregivers ultimately puts long-term antibiotic and nutrition patients at risk of adverse events. Specifically, failure to follow central line maintenance protocols can result in central venous catheter occlusions or infections. It's estimated that there are 58,000 line occlusions and 6,300 line infections per year in home infusion patients, and these line infections are known to be especially life-threatening, with mortality rates between 12 to 25%. These adverse events are also costly for the healthcare system, with line occlusions and infections having an estimated cost of $84.8 and $143.9 million annually. Our Lifeline system is intended to improve patient safety during central line medication and administration at home by increasing access to training materials, tracking central line compliance, and making difficult maintenance steps easier for patients and caregivers. Our solution is composed of three unique components. The first is a patient training mobile application that will be used to increase patient access to educational materials specific to their central venous catheter. Additionally, this app is intended to walk patients through the central venous medication administration process, giving them clear diagrams through each step of the way. Finally, home infusion pharmacies can use this app to remind patients about their medication timing. The second piece of our solution is an interactive medication administration guide that will be integrated with our app to visually guide patients and caregivers through the administration process. It's also intended to simultaneously track their compliance with central line maintenance by checking what equipment that they are using. Finally, a needleless connector asepsis tool will be used by patients and caregivers to more easily disinfect the line prior to access. Specifically, the tool will help to automatically scrub the hub for patients in order to decrease the dexterity required and decrease the variability between different users. Our comprehensive solution is intended to solve multiple pain points for home infusion patients during the medication administration process, and we believe that these three components can help to reduce adverse events in patients. Ultimately, the Lifeline solution is intended to increase patient safety, confidence, and independence, which align well with the current goals of home care. We believe our solution could be expanded in the future to address further systemic issues, such as dressing changes or blood lab draws in home infusion therapy. Our concept might also be applicable to other fields of home care, such as wound or tracheostomy care. Home infusion therapy patients should be confident and free to live a full life during intravenous therapy, and our solution will help to reduce the daily confusion and difficulty that they face.